Hi, I'm Dr. Stephen Heilman. I'm a chiropractor in Escondido, California. One of my specialties in my office is lower back disc herniations that result in sciatica, because our office is one of the very few offices that offers spinal decompression therapy. I want to show you what a disc herniation looks like on a three-dimensional model. Some patients have had an opportunity to see what their herniation looks like on an MRI. But when you're looking at it on a screen compared to a three-dimensional model, we find that showing it on the model gives them a lot better conceptual awareness of what the problem is. So when we look at a lower back, you'll have 5 lumbar spine vertebrae. And so this would be 1, 2, 3, 4, and then put up another model on top of it would give you extra segments. So, but what a healthy model or a healthy lumbar spine looks like, you'll see that the vertebrae has nice smooth borders, and the disc in between the two bones is very nice and thick in the front and the back, and there's a lot of material there. Now from the top, you'll have rings of cartilage that surrounds this jelly-like material. Now that jelly-like material is called the nucleus pulposus, and it's very flexible and it's squeezable and allows a lot of flexibility to the disc. Those rings of cartilage are what they call the annulus fibrosus. So when you look at an initial stage of a disc injury, you'll see that instead of that disc being very well hydrated, the disc will start to dry out. And so when you look at on the MRI report, they'll say that the disc is desiccated, and desiccated means that the disc is drying out. So it's going to be a bit more stiff, and the red just indicates that it is inflamed. Now when you look at the rings of cartilage, you'll see here that the rings are kind of like braided rope, versus this one has some splits in there, and you'll get some tears in there, and that is called an annular fissure. So those are some terms that you may see on the MRI report. You'll also see on this injured disc, because it's dried out or desiccated, that the disc is getting compressed, and that is making this wide open space where the nerve exits through to be narrowed up, and that creates more pressure on the nerve. Now a disc herniation, you'll see on the top a comparison between the healthy model with the very healthy rings of cartilage and that nice flexible nucleus pulposus. And now this disc herniation, you can see that the disc herniation has split through that annular fissure. From the top, this is what it looks like. And from a side profile, you'll see that that disc herniation is ballooned out or protruding out, and it is on this model, it is compressing on the nerve root. Now those nerves will go through there, and they pass from the lower back vertebrae. They go through the buttock and down the leg, and can result in leg pain, leg numbness, or leg muscle weakness. You can get things like foot drop, burning pain in the leg, a lot of sciatica type issues. So what we try to do with our office with these compressed injuries in here resulting in the disc herniation is we apply our patients into spinal decompression therapy, where they're laying down on a table where they can relax. We have a belt that goes around their waist, and the belt is hooked to a computer which applies a nice, slow, gentle traction to the lower back, and it pulls these vertebrae apart so that it sucks that disc herniation back in and off of that nerve root. Over time, this can go through and help rehydrate the disc, make it more flexible again, and pull that disc herniation off of that pinched nerve. If you have any questions, would like a free consultation at our office, call our office at 760-480-4480. We're in Escondido, California, and we are specialists in treating disc herniation with sciatica. Thank you.